What does a pancreatic biopsy reveal about a tumor? Imagine trying to solve a mystery about a growth in the pancreas. A biopsy is like collecting a tiny piece of that mystery to examine closely. It involves taking a small tissue sample from the tumor, usually with a thin needle guided by imaging techniques. The most common method is endoscopic ultrasound-guided fine needle aspiration, which uses an ultrasound probe on an endoscope to locate the tumor and then insert a needle to collect tissue. Sometimes, a percutaneous needle biopsy is used, where a needle is inserted through the skin, or in rare cases, a surgical biopsy may be performed. The goal is to get enough tissue to analyze without causing harm or spreading the tumor. Once the tissue is collected, a pathologist examines it under a microscope. This detailed analysis can tell us if the tumor is cancerous or benign. If it is cancerous, the biopsy confirms the diagnosis of pancreatic cancer, which is crucial because symptoms and imaging alone can sometimes be inconclusive. The biopsy can also identify the specific type of tumor, such as pancreatic ductal adenocarcinoma, which is the most common, or neuroendocrine tumors, which are less common but tend to grow differently. In addition to identifying whether the tumor is malignant, the biopsy can provide molecular information. Advanced testing, called molecular profiling, looks for genetic changes or biomarkers in the tumor tissue. This information can help doctors personalize treatment plans, especially when targeted therapies are available. Sometimes, the biopsy reveals that the growth is not cancer at all but a benign lesion or a precancerous condition like intraductal papillary mucinous neoplasm, which may need different management. The tissue sample is usually obtained with minimally invasive procedures that aim to be safe and effective. While biopsies are highly reliable for confirming cancer, they are not perfect. They have very high specificity, meaning if the test says cancer is present, it is almost certainly correct. However, sensitivity can be lower, so a negative result does not always rule out cancer. If suspicion remains high despite a negative biopsy, further testing or even surgery might be needed. In practice, doctors combine biopsy results with imaging scans and clinical signs to develop the best treatment plan. For tumors that are clearly resectable, some surgeons may proceed directly to surgery without a biopsy, relying on imaging and clinical judgment. But in cases where surgery isn't planned immediately or confirmation is needed before systemic treatments like chemotherapy, a biopsy becomes essential. Overall, a pancreatic biopsy is a vital tool in understanding what kind of tumor is present, guiding prognosis, and shaping personalized treatment strategies. It provides clarity in a complex disease, helping patients and doctors make informed decisions based on solid scientific evidence. Always remember, discussing these options with a healthcare professional is key to understanding your specific situation.